The Austin Edge, live and local. Good day, Austin.
CVI and varicose veins affect more than 30 million people, mostly women, but there are some men in there too. Dr. Stephen Bunker of Bunker Vein and Imaging Center in Austin is here to talk about some of those signs, symptoms, as well as some treatment options. And listen, in the break, I showed Dr. Bunker a little bit of a spot where it's kind of a vein, but it's not popping up. And you even saw a bigger picture on my leg saying,
Sure.
Well, maybe you should come in and have that looked. So this is really common.
Yes, it is.
So what causes the varicose veins, or CVI? What is CVI?
CVI stands for Chronic Venous Insufficiency. The overall picture is that we have veins in our legs that are special blood vessels that are designed to take the contaminated blood out, return it back to the heart. When the blood is conducted along these veins, there are little check valves that you see on the screen right now, which disallow the blood from going backwards. But when they break, these valves break, and they allow the blood to go backwards, the pressure backs up into the little veins that are draining this blood from the skin and the muscle. So this causes dilatation or bulging of the veins on the skin.
Ah, I see.
The interesting thing is that even without visible signs on the skin, the valves underneath can be damaged, and so patients may present with symptoms like heaviness, aching, burning, or itching of the skin. And with 30 million people running around with this disease and only, say, 1.8, 1.9 seeking treatment every year, it's really an epidemic.
Yeah. Who are the people most at risk? I would imagine moms. I have a lot of friends that are pregnant or thinking about having kids or
Sure.
in the process of building a family, and I know that varicose veins are prominent among, pregnant women.
Right. Anything that increases pressure down the legs. So a lifestyle where you spend prolonged periods of time on your feet or you're sitting constantly, people who are overweight. Women are about 3 times as likely to develop this condition than men. But in my experience, genetics has been the biggest predisposer to the disease.
Oh, so you don't really have a choice sometimes.
No, almost everyone that comes into our center
Says their mom.
grandma, mother, father, aunt, uncle, brother, sister has vein disease.
Okay, so talk about treatment. Can we, because I'm just thinking from, an aesthetic point of view.
Sure.
Can we get rid of these?
Sure. The problem is that it's more than just a cosmetic issue, and so insurance companies will underwrite the diagnosis and
that's
treatment
good.
in almost all cases. The treatments used to be the old stripping of the veins we've all heard
Nice.
about. This pretty much set you off for a couple of weeks of recovery, required general anesthetic and so forth. And that's rarely done anymore. We have newer techniques where you walk in, half hour later the treatment is done, you walk out, and you can usually return to your normal activities within a day or 2.
No kidding. And this is different than like the spider vein, right?
Right. Spider veins are just little tiny burst blood vessels on the skin, which women tend to get more than men, usually under estrogen stimulation, but there is this underlying pressure problem that can contribute to them as well.
So if you have spider veins, maybe this is something that you want to go see a doctor about, because there could be an underlying vein issue.
Exactly. So many people come in and they'll get their spider veins injected by someone, and they'll come back. Maybe 2 or 3 times in a month or 2, they'll just get more spider veins, or they'll come back in the same spot. So when that's the case, you need to look for underlying problems.
Yeah, what about age? Does this discriminate? Because you said you did have a patient that was 19.
Right. It occurs at all ages. The youngest patient we have was 19. The oldest was almost 100. And the reality is that the damage to the veins increases with age.
Yeah. Where can we find more information?
Well, you can go where the national campaign's website is rethinkvaricoseveins.com. And you can also check our website, which is bunkerveins.com.
Okay, great. Thanks, Dr. Bunker.
Thank
Very
you.
interesting. I may be going to see him here soon. We'll be right back.